Welcome. This pranayama is the beginning practice of alternate nostril breathing called Nadi Shodhana. Oftentimes, when this practice is taught, there's a placed around the nose, and then there's instruction to breathe into one nostril and then out the other. For some, this is really accessible and available and has really lovely effects on balancing the nervous system. For others, the idea of closing the airway off can be really challenging and create almost a sense of claustrophobia. And so we're going to start with identifying the placement of the hand and how it is placed around the nose. And then the very first practice of Nadi Shodhana, as described by Iyengar and Light on Pranayama, is not going back and forth between the nostrils, but just learning about how to feel comfortable breathing through a slightly narrowed airway. Take a comfortable seat. Make sure that your head is aligned over your rib cage, is aligned over your pelvis, whether that's on the floor or in a chair. That's really important because what we're doing is we're placing the diaphragm in as effective positioning as possible. If we're slouching, it tends to tip the diaphragm forward. If we're overarching, it tends to tip the diaphragm backwards. So we want the diaphragm in its most neutral position possible. We're going to use our right hand as the instruction. That's traditionally the hand that you would use for Nadi Shodhana. If you are left-handed, please feel free to use your left hand. If you're right-handed and want to play around with using your left hand, by all means, be creative and be interested in what it feels like to do some of these asymmetrical practices with your non-dominant or less coordinated side. And so with your right hand, you're going to fold your index and your middle finger to the base of your thumb, and then stack your fifth finger on top of your ring finger. It's almost like they become one entity. And then your thumb is going to rest above the bell of the nostril on your right side of your nose, and your ring finger is going to rest on the bell above the nostril on the left side of your nose. And so what's important here is that we're resting the hand. We're not squeezing the nose and closing off the bells of the nostrils. In this practice, the movement of the hand should be minimally perceptible to someone watching you. The nose should not be moving in a really visible manner. That's too much force, too much pressure. Take a few breaths just with that very light pressure from the ring finger and the thumb around the airway from the left and the right nostrils, and just kind of see how that feels. Make sure that your posture has remained upright, that you're not sort of slouching forward or leaning to the right. And then if this is bringing up any sense of breathlessness or anxiety or discomfort, this is where you're going to practice for the remainder of this short, about 5 more minutes of pranayama. If you feel comfortable here and would like to start working with a narrowed airway, you're going to very gently give slight pressure on both sides symmetrically. And so what you're doing is you're symmetrically narrowing the airway so that your body has a little bit more resistance. It's like narrowing a pipe. We're trying to continue using deep breathing, but through a narrowed space. You're going to inhale through both nostrils and exhale through both nostrils. If you are congested, Feel free to blow your nose at any time, right? There's no need to decline that for yourself. And we're going to work with just breathing through a narrowed airway for the next few minutes. If at any point you need a break from the narrowed airway, just release the gentle pressure and take a few moments to breathe. You can also rest your hand down and then return back to the hand placement over the nose. And see what it feels like to have this experience of holding your hand in a particular way, breathing through narrowed nostrils, and focusing in on the breath. Complete the pranayama on an exhale, and then release the hand down onto the lap. Take 2 to 5 breaths, just feeling now what it feels like to have what are the normal, your normal diameter airways available to you again, right? Is there a sense of exhilaration or ease or relief? And then join the hands together at the heart center, Anjali Mudra, prayer position. Bow the head down towards the fingertips. Act of gratitude for taking time to practice. May all beings be happy. May all beings be healthy. May all beings be free from suffering. May all beings be safe. Namaste.